Hello, everyone. Hope you guys are having a good day. We are going over knee pain with COVID. So, we're going to talk about knee pain that you have after you've recovered from COVID. And you may have had symptoms with COVID. You may have had no symptoms, but just have known you were diagnosed with COVID. So, we're seeing a lot of post-COVID symptoms now. And it doesn't matter if you had COVID and you were so severe you were in the hospital, or you had COVID and you had no idea you had it. You just got tested because you knew somebody in your family had it, so you went and got tested. Either way, we are seeing symptoms post-COVID. And these symptoms can come months later, they can come weeks later, they can come days later. It's really important to understand that it is not just a simple recovery process. We're seeing things that are going on for months and they're lingering, and because this is so new, we're not really sure exactly how long they're going to last or exactly when they come on. And it really has no bearing whether you had the severest of symptoms or the mildest of symptoms, whether you get these post-COVID symptoms. Some people who had severe symptoms have no post-COVID symptoms. Some people who had no symptoms have these symptoms. So there are a lot of symptoms that are coming up that we're seeing. We haven't really made heads or tails of exactly what symptoms you're going to experience. You can have all of them. You can have none of them. Sometimes we're seeing it in a specific joint. Sometimes we're seeing it more global, meaning throughout the whole body. So pay attention. And I know every time I post something, people always ask more specific questions. We do offer free consultations. All you have to do is call our office at 215-997-9898, and we'd be happy to get you in. But it is important to understand that, what you experience can be completely different from what somebody else experiences, and it can be completely different than the next person. Even if you have the same symptoms during COVID, it can be completely different. The recovery process, how you go through the recovery process, exactly how you feel, and so on and so forth. So it's just important that you understand that it is not a cut and dry type of answer, and it's not a one-size-fits-all type of answer. I'm going to cover as much as I possibly can of the symptoms you can experience, how you can get over them, and things like that. But make sure you understand that I may not hit everyone, and I know there's little nuances, and I know you may have had COVID and may be recovering from COVID and not have what I'm talking about, or it may have it more severe than what I'm talking about. So it's, this is not, again, a one-size-fits-all model, and we're learning more and more every day because now we are in the recovery phase of COVID. So we're learning a little bit more each day about exactly what's going on. But this is what we're seeing in the clinic. This is what we are treating right now. So we are seeing, when it comes to knee pain, we're seeing a very diffuse ache. Almost like an arthritis pain, the joints are achy. This can result in loss of motion. It can result in pain. It can result in loss of balance, strength issues. So we've seen a decline in not just the knee, but a lot of the joints in some of those things. So again, you may have trouble now going up and down the steps. Now that may be because of your knee, that may be because of your lungs, but we're starting to see that type of issue. Standing on one leg could be difficult. That is, again, some of the things we're seeing. We're seeing loss of balance, almost like a dizziness, but not having any dizziness feelings, just not being able to balance on one leg. We're also seeing loss of mobility. So whereas before you can bend and straighten your knee with no problems, you now have an issue when it comes to bending and straightening your knee. You may have pain at the end of bending your knee or at the end of straightening your knee, or you may not be able to get your knee all the way straight, or you may not be able to bend it all the way. Either way, whatever these symptoms are, you want to get them investigated. You want to get them treated. It's not something you want to wait for it to go away on its own, especially like loss of balance, loss of range of motion. Those things you need to really get back as soon as you can. And because we don't know how long this is and how long this can take, it's important that we speed the process up by doing some exercises, by going to therapy. So if you are in that post-COVID state and you have those symptoms, loss of strength, loss of range of motion, pain in your joints, and come and seek help. It's really important. you want to, one of the things you can do right away is just start to practice your balance. Start at a table. You want to just start practicing your balance nice and easy, starting to stand on one leg. It may be too painful. If that's too painful, then stop. All right, but you want to really try. You should be able to balance on one leg with your eyes closed for 30 seconds without touching. All right, it shouldn't be that big of an issue. If you find that you're having problems with that, then you need to, again, really seek treatment. When you're talking about bending and straightening your knee, you can just do exercises where you gently bend and straighten your knee to try and get that range of motion back. Really important to maintain the full knee range of motion, or any joint, as long as you can, to avoid that knee replacement or that hip replacement. So, it's not something to ignore, because those little losses of range of motion will add up over time, and you don't want to let them linger till they become big losses of range of motion, and then we're discussing things like knee replacements and things down the line. So you can do gentle range of motion exercises, nice and easy, but if you find they're really painful, again, stop and seek treatment. It's super important that you take this seriously and that you seek professional help, because again, it's all new and we have to ramp it up slowly. We do see some aggravating factors that are happening, so you don't want to rush right into it and dive right into it and say no pain, no gain, and let's push through this, because you are dealing with something that's a little bit newer. Your whole body is responding to that positive test, to having had it. So just be aware there are certain things you want to make sure that you listen to your body with, that you adhere to, because it's important that you make the right decisions, because those decisions going forward impact the recovery process. If you or someone you know has had COVID and are suffering with any sort of joint pain or any sort of issue, and you want to talk with a doctor of physical therapy, we offer free consultations. All you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good night.